Sorry, I was muted. Hi.
Hello, hello.
Sorry.
So,
So welcome everyone to the Fullerton Collaborative General Meeting. We have people joining us, and I am, of course, recording this and putting it on our Facebook. So we have live feed. And as a reminder, as I'm doing this, if you don't want anything behind you, if you wanted to have a background or whatever you feel comfortable with, that's fine. And this will be recorded and also available on our YouTube channel. So with that, I'm going to just remind everyone to make sure you're on mute. And if the chat is there, please probably wait just a few minutes as people are joining. If you have flyers that you want to share, or if you want to share contact information, probably wait just a few minutes as people are coming in. And I'm going to turn it over to Leanna. And Leanna, as you're looking at the welcome, I'm going to pop in the agenda in the chat.
Perfect.
So you'll be able to see the agenda as well. So hopefully everyone's having a fabulous
Can we
Monday.
believe that it's already February 8th, right? I know. Jason's like, no. It's wild that it's already February 8th. But this month flew by, and we're just so excited to be with all of our members and partners and our board again today to be able to discuss and work together to do what we can to make Fullerton the best that it can and to have support for our individual organizations. So again, my name is Leanna Fercucci. I'm the board chair of the Fullerton Collaborative, and I am also co-owner of CF Dance Academy and the Classic Fullerton Ballroom here in Fullerton. So first, to start our meeting, we are very, very fortunate to have Antonia Graham. She is the Deputy City Manager for the City of Fullerton. And as many of you might have known, there's been some changes that they're going to be making with the Parks and Recs community in the community. And also this is going to be affording some of our organizations an opportunity to grow within the city of Fullerton. We're so excited to have Antonia here to explain to us those changes and how some of your organizations can possibly benefit from these changes that will be happening in our city Parks and Rec program. So Antonia, I'm turning it over to you.
oh gosh, thank you, Leanna. I don't know if you guys should be that excited that I'm here, but I'm glad that you are. I'm excited to be here. I think the collaborative does great work. Many, many moons ago, my father was very involved in the collaborative. And so I'm very happy to be here and give you this update. Leanna spoke about some changes in the Parks and Rec department and in the city's overall organizational structure. Hugo Curiel, the city's former Parks and Rec director, has moved on, and the Parks and Rec department is now reporting to the city manager's office. And because of COVID and the city's financial constraints, we really wanted to look at being creative and yet still offer services to our community. It's extremely important that recreation and social services are offered to our residents. And what better way than to partner with experts? And so we put an RFP out, and I see Steve Pischel is also on the call, and he is with Athenian Partners, and he's been helping the city with this RFP process and the sort of reorganization of the Parks and Rec department. The RFP was really meant to, I almost liken it to a fishing expedition. We really want to see what interest is out there from the nonprofit community to see if anyone is interested in providing services at any of our centers. So the centers we have that we're looking at are Gilbert, Maple, Orangethorpe, and then some recreation buildings, Chapman, Hillcrest, the Red Cross at Hillcrest Park, Independence Park Gym, the Isaac Walton Cabin, and Lions Field. So we're looking at partnerships to continue to provide the great services in the community so our residents don't really see a change. But this is really necessitated because the city has some very severe financial constraints. And as you know, because of COVID, which has exacerbated our financial constraints, we really had to look at some creative solutions. And so this is why we've put this RFP out. We all are also looking at putting an RFP out on our tennis center, which should probably go out this week. but I'm really here to just answer any questions, give you the update of our department, what's going on. Ultimately, we are still wanting to, at the end of the day, we really just want to provide services to the community. Unfortunately, with our staffing constraints, we just don't have the ability to, and we really want to look for partners that can help the city continue our mission. So I'm really just here for any questions that you might have about our RFP or about, what's going on at the city. So I can either in the chat box, or if you just want to chime in.
Excellent. Thank you so much. I've actually, if people want to put it in the chat, you can include that. We're also keeping an eye on our Facebook page as we're seeing people also watching there as well, the public. So.
I have a question. Are these opportunities available to for-profit and nonprofit equally? Or
yes, I'm sorry. I misspoke, Leanna. It's for profit and nonprofit.
Okay. Okay, I have a question here. How can we ensure that low-income persons are served in these communities?
So what I said, when we are going on like a fishing expedition, we want to see what interest is out there. Ultimately, the city staff and the Parks and Recreation Committee will make sure that that services that are that are offered right now are going to be continued to be offered in some sort of fashion. So anything that is in our low-income communities, we want to make sure that those communities, that their services are unchanged. They just will have a different provider. So it's of absolute importance to us that we ensure that there's a continuity. It's just not maybe the city, maybe it's a nonprofit or a for-profit, but every center that has services will continue to have services in some fashion. And, we could go through this whole process and not award it to anyone. We could just continue it as is, and the city, it's up to ultimately to the city council, but they could decide to just continue to operate as we are now. We don't know how long we'll be in this tier from the governor with being unable to provide, some of our old services, but we want to make sure that all neighborhoods are served. That was a great question. Thank you.
I have another question. Is there a certain type of programming right now that would get like not necessarily priority, but maybe you definitely know that there's a definite need for that the city is worried about losing, that would have a look at a priority for certain nonprofits to take over those services?
We don't have a certain priority or like what's number one. We really just want to see what services these providers are willing to submit. There's no, we really just looked at the buildings that we had and want to hear back from the nonprofit responders about what they're suggesting. It doesn't mean that we will have, ballet over tap or so we haven't prioritized anything. We want to continue services. Ultimately, the priority comes from Parks and Rec Commission and City Council, but as staff, we have not prioritized. But you bring up something interesting that we are going to be looking at doing tonight on the Parks and Rec Commission. On the agenda is the discussion of a Parks and Rec master plan. And part of that master plan effort is doing a community survey to find out what does the community want to see in terms of parks and recreation. And, does the community really want to have pickleball? Is there interest for lacrosse? Is there, because as the community, as demographics change and as communities age, sometimes people don't want to play tennis anymore. They want to play pickleball. So that survey will help us really glean the priorities of the community. But as staff, we have not prioritized, projects or programs, I should say.
This came up in our board meeting when we were discussing this. Will there be an opportunity for some organizations to partnership for certain sites if they can't take on a site on their own, and what that responsibility would be?
I think that's a great idea. I think that absolutely, if you, say, Leanna, you wanted to have your dance studio partner with, a nonprofit that offers like after school programs to kids to offer ballet classes, that could be, something. I'm just using an example. That could be a partnership. Or you have a healthcare provider that maybe wants to partner with a social services agent. There's a whole multitude of things that, you know, could be, I mean, we're really looking for creativity here. I mean, we don't really have any one thing in mind.
Okay, there's a question in the chat. What sort of RFPs? Maintenance, construction, services?
So the RFP is entitled Neighborhood and Recreation Facility Lease Partners, and I'll put it in the chat so you can, I'll look at it. But it is, if you look, so say you're interested in Independence Park and you want to see, and it's older, and you feel like the services you provide would necessitate the need for a new floor, you would put that in your proposal. But there's no alterations that could be made to the park surrounding the centers. But if you feel that you needed some tenant improvements, so to speak, in the building, that would be included as part of your proposal. But it is not a requirement. And then ultimately maintenance, things like that, those will be negotiated items between the city and whomever is deciding, you know, if they want Gilbert Center, you know, what will maintenance look like? Will the city continue it, or will the nonprofit or the for-profit? It's really all up in the air until we negotiate with a successful bidder.
I might just piggyback on that. This is Steve Fischel, and working with Tony. Just to be clear, wanted to make sure that you understand that there's opportunities. If your organization, for example, has an opportunity to get grant monies for capital improvements that might be needed at a particular facility, you could build that into your proposal, into the RFP or RFB. If you have the opportunity to perform maintenance on a particular facility, or if just fundamentally your strengths are going to be the in-kind services you're bringing to the table to provide to the community, that would be the crux of your proposal, and you'd be able to share that. And then, as Tony shared, we would negotiate with you as far as the maintenance of the facilities or capital improvement needs and so forth, and collaborate on making that happen. This is not unique as well to Fullerton, and I know one of the members is on they called Dr. Jones, the Centers for Healthy Neighborhoods through Cal State Fullerton. That's a really good example of the current collaboration that the city has. And that particular organization, I want to speak for Dr. Jones, but they're collaborating with multiple organizations and other nonprofits to provide the services to the community that are much needed, and the city is not able to provide. So that's an example. Fullerton area swim team, FAST, many of you've probably heard of them. They're providing swimming programs at the Janet Evans Swimming Complex and also at the Fullerton Community Center. That's another example of an existing partnership. The Fullerton area, or the Fullerton recreation riders, provide recreation horseback riding in and around Laguna Lake. So those are examples of some of the current agreements that the city has for collaborations that could be expanded upon with other facilities and operations.
Thank you so much. Debbie, do we have any questions on Facebook that are coming up?
I'm not seeing any, Lisa.
Yeah, I'm keeping my eye out, and there haven't been any comments yet.
Perfect.
On Facebook.
Okay, if we don't have any more questions, was there anything else you would want to add just to wrap up, Antonia?
No, I mean, I think you're going to see, even though there's been some organizational changes in the Parks and Recreation Department, I mean, we continue to offer great services. I know the community center has been rolling out some really interactive art programs. We have our Feed Fullerton program. We are in discussions. We met today on what does a reopening of the museum look like should the governor's order be lifted, you know, maybe perhaps in April. And we're definitely moving things forward here. You'll see at the council agenda on the 16th, we'll have an Adopt a Trail program for any interested parties who are interested in, you know, adopting a segment of a trail and doing a cleanup event. So, you know, we're still continuing to provide services in this, you know, COVID world.
Antonia, I also saw that the city has now a newsletter. How does one get access to that?
Yes, that's a good question. I will put it in the chat box so you can subscribe. It's a new format of our City Manager Weekly. So it just has a new look. We're getting ready to revamp our website too. We'll probably see a new website in March, April, but I'll put it in the chat how you can subscribe to our newsletter.
Perfect. Thank you so much.
And
So If we're already getting the city manager's report, will that be replaced by the newsletter?
Yes. Yeah.
Okay.
Oh, I love your orange cat. Yes.
Thank you.
So we might have more questions coming in. If you, I know Antonia, you're very busy. If you want to hang out just for a little bit, and you can also ask direct questions for her. But we can go ahead and move on to the agenda, Leanna.
Perfect. Okay, so next we have our Mr. Barry Ross from our board that he is going to give us an update on the vaccine and what are the next steps for that in Fullerton.
Thank you, Leanna, and I appreciate the opportunity. And what I just want to say is, as you probably see in the news, the situation with the vaccine changes by the minute. So what I say today, the governor may do something or the president may do something, and it may change. But I will give you some of the information we have today, and more importantly, some information about why some people are hesitant to accept the vaccine, so that we could look at how we as trusted organizations can respond accordingly. So I'm going to share my screen. Okay. So I called it an evolving journey because that's what it is. Just very briefly, there's a lot of vaccines listed here. And the good news is that there's lots of vaccines that are in the pipeline. There are 2 that are being actively administered right now, Moderna and Pfizer. The Janssen is the Johnson & Johnson vaccine. That vaccine may be approved by the end of February. And what's exciting about that is it's only 1 shot. But these are basically different ways to administer the ability for the body to react to the virus and to develop antibodies. So if you get the virus, you can fight it off. And that's what these vaccines are mostly about. So one of the questions that comes up is why 2 doses, particularly for the 2 that we have now. And this graph kind of shows you that after the first dose, you get an immune response, but then it goes down, and the second dose really boosts up that immune response. And that's what makes those 2 vaccines, the Moderna and Pfizer, 94, 95% effective because of that second dose. Now, there's a lot of discussion now. Do you have to have the second dose? And can you wait? But right now, the recommendation is that you should have it in the time frame that the research says, they studied, because we don't have any data that shows something else, but that can change. So the 2 vaccines we have now, these are the ones that you would get if you are able to get one, which is now for people 65 and over mostly, and healthcare workers. And so the Moderna is for 18 and over. Pfizer, I believe, is 16 and over. They are doing studies right now for children. Children could enroll in studies as of October, but there's no data at this point. So in order to get true herd immunity in the country, which is anywhere from 70 to 80+% people vaccinated or immune, we need kids to get it too. But we don't have the data yet to say it's safe and effective, but that should be coming in the next few months. And then we're gonna have to get, we're gonna have to get, ways to get it out to children. Orange County is declared what they called Operation Independence. And this is the idea to complete all vaccines by July 4th. That's the objective. I think it's a wonderful objective. I don't know that that can really happen, but it's a great goal to have. And the way they're doing it is through multiple sites, which I'm going to share with you. This is some facts about the different vaccines. The one thing I want to say is that these vaccines have to be used fairly quickly, particularly the Pfizer. Once you puncture the vial, you have to use it within 6 hours. Once you thaw it, you have to use the Pfizer vaccine within 6 hours. So there are a lot of restrictions that make it challenging to really administer the vaccine, because you want to make sure it's a good vaccine dose and it's not in any way not usable. And so that's been the challenge. The Moderna doesn't have to be ultra frozen, which is good. And the Moderna doesn't have to be reconstituted. So these are some of the ways that the county wants to reach the community. One is through traditional providers, hospitals, clinics, medical groups. So what we're seeing now is, like the hospitals, we're starting out just giving the vaccine to healthcare workers, but we've pretty much reached our healthcare workers that want to accept the vaccine. So I know at St. Jude, about maybe less than 2 weeks ago, we started opening it up to seniors in our that are affiliated in some way with us that are 65 and over. Our affiliated medical groups are going to start giving the vaccine, but the amount of doses available are fairly small right now. So they are contacting the highest risk patients rather than opening it up to everybody. The community clinics will be starting to get vaccine, but currently I know our clinic in Richmond Park is not doing regular vaccinations. We are going to be hosting a vaccine, the clinic is with the hospital at the Fullerton Community Center for people already on a waiting list that are 65 and over on the 19th. So it's not open to the general public. It's just a start to start getting vaccine out into the general community. The county has opened up mass vaccination sites called super pods. Their goal is to open up 5 in the county, 1 in each supervisory district. The first one is in Supervisor Chafee's district at Disneyland. I'm a nurse and I volunteered there a few times already. The goal there is to reach 7,000 people a day. They're not able to do that with the staff and the vaccine they have. They've been reaching between 2,000 and 5,000 people a day. The second site is at Soka University in South County. They're also talking about small, what they call local pods that the county is supposed to operate, which I believe they're going to do them at least weekly. I don't have the locations. And then what they're calling mobile strike teams, where they'll load up a van with vaccines and they'll go to very high risk areas. They haven't started those yet, although they've done some, what I would call strike teams, where I know they've been to a senior citizen apartment building a few weeks ago on a weekend. The county did that. Eventually, hopefully soon, retail pharmacies will carry the vaccine. They currently have been, CVS and Walgreens has been giving out vaccine to nursing homes and assisted living facilities in Fullerton. But the hope is that they will get vaccine for the public, and starting with people 65 and over. They don't have it yet in California, as I understand it. Okay, so this is where we were as of February 2nd. 288,000 plus vaccines were given in Orange County. Now, that's first and second doses. So, you know, we're probably looking at maybe somewhere between 150,000 or less that got 2 doses. Remember, Orange County has 3.2 million people. So we have a long way to go. You can see that women have higher rates than men. And I do believe one of the reasons for that is because healthcare workers were the first group, and about 70% of healthcare workers are women. So I'm not surprised to see that. I think that will change as it shifts more to the 65 and over group. In the racial composition, you can see a high percentage of Asian Pacific Islanders and a fairly smaller percentage of Hispanic. And yet our county is about 34% Hispanic. Again, I think that reflects the composition of our healthcare workers. We have a higher rate of Asian Pacific Islander healthcare workers. We also have a higher rate of older people in the Asian Pacific Islander community than in the Hispanic community. But definitely there's reasons for this. And the age group, you can see that the older age groups actually are smaller here than the younger. And that's because, again, healthcare workers are younger, but we're going to start seeing a higher percentage in the age group that is 65 and over. Why are we focusing on older adults? It's because the deaths occur much higher the older you are. So this is the death rate per 100,000 in the United States. So you can see where the deaths are coming from. And that's why the focus is on people that are older. So how willing are older adults to be vaccinated, and how safe do they feel? This is a study, this data that I have, Orange County did a study on vaccine acceptance and hesitancy. So you can see that in the Hispanic community, less than half of older adults were willing to be vaccinated because less than half felt they were safe. And in the Black community, only 25% felt that they were safe. So there's a real need for education, particularly in minority communities. So what are the conclusions for older adults? All older adults need to be targeted, but safety is their big concern. And we need to address the need of the Hispanic and non-Hispanic Blacks. One of the arguments for this group is that they are at more serious jeopardy of getting very sick. And the idea about protecting others may be a way to help get them to address and accept this, because they want to help their family, they want to help their neighbors. This is an interesting study. It was a survey they did on educators, teachers and educators, willingness to be vaccinated. Less than 60% of educators were willing to be vaccinated. And again, much lower percentages of Black and Hispanic educators willing to get vaccinated. So what were the conclusions there? They said addressing safety. And again, how does this benefit others? How will this benefit their students, the families of the students? That could be a way to encourage them to accept the vaccine. This is first responders. So this would be police officers, paramedics, EMTs. Only 46% were willing to be vaccinated. And again, here the hesitancy was pretty across the board by race, which is very interesting. And then why are people willing to be vaccinated in general? Because safety, they feel it's safe, they don't want to get a serious illness, and it will benefit others in the community, their family. So these are messages we want to get out of why it's important to be vaccinated. So first responders, the same issue. We need to particularly address the seriousness of the illness because they're exposed to people with COVID. Food service workers, again, very low percentages of Hispanic and Blacks willing to be vaccinated. And again, as you can see, safety is their main issue there. This slide is just the county website. Right now, In order to sign up, if you're a healthcare worker or 65 and over, you can go on athena.com and you can sign up. It may be difficult to get your first appointment, but I know somebody that signed up a few weeks ago and was able to get an appointment. I understand, I heard it was sort of like a lottery, not first come, first serve, because there's so many people requesting appointments. I also heard that the state has come up with a new data platform for scheduling and reporting called My Turn, and there's been negotiations between the county and the state about whether this county will continue to use Athena as their way to access the vaccine. So that's a brief overview. Just want to say we're seeing some good news at the hospital at the height of the surge, which was probably in early January. We had 240 COVID patients on an average. That was our high, actually. Today we had like 107. So our numbers really went down. That's the good news. But we still have over 100 COVID patients in the hospital. And the hospital's been very busy. So I would be glad to answer any questions. But what I would say is many of your clients are not 65 and over, but they may have family that are 65 and over. And so we really want them to encourage them to help their family members get the vaccine. And I believe soon we're going to see more of an emphasis on high-risk populations. And so we'll be communicating when it opens up more to other populations. So any questions?
We did have a question from Zoot about those other populations, especially the immunocompromised and education staff teachers. When do you think those will be coming up as being able to be vaccinated?
It's a very good question. I think the question about educators is right at top of mind with the governor, and they, the teachers, many teachers unions don't want to come back unless they are, the teachers are vaccinated. So there's a lot of pressure, I think, on the governor to open that up. I don't have a prediction. I think that may happen sooner than later, but because people want to get kids back to school, that's a priority everywhere. But as far as other high-risk populations, it's very hard to say. If the Johnson & Johnson or the Janssen vaccine is approved, I think that will help. Now, one of the questions that's come up is that vaccine is about 66% effective to 72% effective as compared to 94, 95%. There's a lot of question about, well, who should get which vaccine? And, we don't want to give certain priorities for different vaccines. The reality is if people get any of the vaccines, they won't get very sick and they won't get to the hospital. They won't have to go to the hospital. They may get COVID symptoms. They may have to stay home, but they won't get very sick. And so it doesn't really matter which vaccine they get. Right now, they need to get a vaccine, and that's going to become an issue. So my hope is that if that's approved, we'll start seeing it open up to the high-risk communities. But I can't predict right now when that will happen.
Thank you. We have another question, and I think you said it was the County of Orange, but who is organizing those mobile strike teams?
Yeah, it is the County of Orange and also some of their partners. I saw recently, I think Latino Health Access was organizing something around Santa Ana. And then I see there's a reflection about stats reflecting about people who are hesitant, also hesitant about any vaccine. I haven't seen specific stats around that question.
Shelley did share from Cal Optima that seniors age 65 or older can receive the COVID-19 vaccine within the next few weeks through the COVID-19 Vaccine Equity Pilot Program, a joint effort between Cal Optima and the Orange County Healthcare Association.
So it'd be helpful to know how they access that. That would be helpful.
Shelley, can you share that with us?
Yeah, hi everybody. So basically this was discussed at the last board meeting that CalOptum and our board members had last Thursday. So it's been a crazy couple of days, but to my understanding is that the plan is that some of our providers will be receiving the vaccine, and that way they can reach out to the CalOptima members. So for those that don't know, CalOptima serves the underserved, as Barry was mentioning. A lot of the Latino population are not accessing the vaccine. So this is kind of like the way that will help increase those numbers, hopefully. And to my understanding and what was shared at the board meeting is that there will be about 1,000 vaccines that get distributed on a daily basis. So hopefully on a weekly basis, it'll be 7,000 people, specifically seniors over the ages of 65 and older, that will have access to the vaccine. And again, that's through the providers that are contracted with CalOptima.
Thank you so much for that information, Shelley. Does anybody else have any questions for Barry regarding the vaccine? Yes, Jean. Oh, you're muted, Jean.
Barry, I live in Rancho La Paz Senior Mobile Home Park.
Mm-hmm.
We have 365 homes in here, and about 80% of us are homebound. How do we get a pod in here or something for our members?
That's a good question. I know there's been some discussion at the county about how to reach homebound people and using providers that are providing maybe home health or having those services. One thing we could explore, but I can't promise anything because it's really whether or not we have the vaccine. You know, we're doing what I call pop-up clinics. So the clinic we're going to do at the Fullerton Senior Center is we're calling a pop-up, and our goal will be to do 400 that day. If we can get vaccine, we might be able to do something there maybe. I don't know. I'll put it on our list, but I do know the county is talking about trying to figure out a way to reach homebound people.
Thank you.
Okay, if we don't have any more questions, we are going to move forward with our subcommittee reports. All right, so our first subcommittee report will go to Trang Lai from the Fullerton School District, and she is going to give us an update for our education subcommittee.
Good afternoon, everyone. I don't think many of you know who I am. Again, my name is Trang Lai, Director of Educational Services and Child Development Services. And basically what happened was that Meryl Lee Cosgrove retired. And so I have the honor of walking in her footsteps and trying to keep up with Meryl Lee. So Barry, Ross, and I have been in discussion, and we, after taking a hiatus due to COVID, we are going to be starting up the Education Subcommittee again. And our first meeting will be on February 24th at 3 p.m. and it will be done through Zoom. We have about 12 plus members who will be there at that meeting. If you are interested in joining us, I'm going to put my email into the chat, so you can feel free to email me and let me know if you want to join. Right now, in discussion with Barry, the things that was our focus is going to be on early learning and care. That was what the committee was focused on earlier before COVID, and we want to continue that. We have data about our community and where our needs of our community are. And so we'll be working on that. We're looking at how do we serve our community within the next 6 months, and then what can we do within the next year. So it's going to be a working group, and we'd love to have all of you join us. So please email me if you're interested in joining the Education Subcommittee. And again, it'll be on February 24th at 3 p.m. through Zoom. Thank you.
Thank you so much, Trang, and welcome to our group. We're so happy to have you as a subcommittee chair. Sounds great. So happy to get these subcommittees rolling again, too, as we get ready for finally getting out of all of this. So next we are going to have Mr. Jason Phillips do our update with our homelessness group.
Thanks. I had put a flyer in the chat earlier. I think it was the Spanish version. I just put the English version, but there is rental assistance available, and Pathways of Hope is one of the groups who's providing for that. You do not contact them. The information for contacting about rental assistance is on the flyer. It's through 211. But David, I don't know if you could give some more insight of exactly what that is and what other possible pipelines might be coming down the road.
Yeah, yeah, sure. Thanks, Jason. Just really quickly. So yeah, so Pathways of Hope, we were selected to administer about over $20 million of rental assistance dollars for people affected by COVID in all of North Orange County, except for Anaheim. Anaheim is the city that has its own program that is exempted from this money. But as far as for Fullerton, folks just need to contact the ways specified in the flyer. Calling Pathways of Hope or emailing or texting us directly will not work. We get the referrals directly from 211's front door portal. A couple of things, just so, because I know people are watching this on Facebook, and you all will go and talk to people that you know that could use this service. It's really important to remember that you have to be in arrears, and it has to be related to job or income loss related to COVID. It cannot be for other reasons, or it cannot be advance payments on rent you are afraid you might not be able to pay, which is what we've gotten some people who have signed up because of that. We are able to help people up to 80% AMI with this. So average median income of 80%. So that does widen the net a little bit of people that can be assisted with it. As far as other potential streams to help, there is a state fund that's been set up as well. I don't know how it's going to be administered yet, but keep your eyes open for that to come down the pipeline. Not sure which organizations are going to be running that one. Aside from that, obviously the $1.9 billion or trillion COVID relief package that's moving through Congress right now and working in budget reconciliation also includes a significant amount of money of rental assistance to then back this up. So provided that goes through, there may be even more resources coming down the pike, which I think everyone is grateful for. So again, if you're interested, or you know, or you have people you work with that need this assistance, please have them contact one of the 3 ways on the flyer that Jason posted, and get them signed up. On day 1, we had 1,800 applicants for the program before 5 o'clock close of business. So yeah, I think that's about it.
Thank you so much, Jason and David. I really appreciate it for that update. Okay, next we're going to move on to Christian with Hoya Scholars, and he's going to give us an update with the work him and Bev Berryman are doing with our Next Gen Youth Empowerment Group.
Thanks, Leanna. Hi, everyone. Christian with Hoya and over at Next Gen. Me and Bev continue to host our monthly Next Gen Youth Empowerment subcommittee meetings. Our next one is going to be on Tuesday, March 2nd at 10 a.m. And I'm going to drop that date and also my name and my email address in the chat for everyone. We had about 12 partners getting together last Tuesday, and we're really encouraging all of our, of course, our nonprofits who are specifically serving youth from our low-income neighborhoods to get together. It's very important for us to get a sense of what services are being offered. That way we can share those and refer our youth to other organizations in the community. A couple of quick calls to action for the entire collaborative who's here today are a couple of things. For the next few months, Bev and I and everyone over at NextGen are focusing, of course, on workforce development. That means a couple of different things. Number one, can we get some job board resources aggregated that we can share with our youth? That way we can try to connect our youth ages 16 to 22 specifically with some local short-term job opportunities. And then number two, some longer-term career-based like vocational programs. So I'm gonna ask 2 questions at the collaborative here. Number one, if anybody here has like an online job board that they know of, or a job resource, an employer portal, some sort of website, something like that, feel free to send it my way and I'm gonna aggregate all of those. That way we can put it together and share it with our youth across the city. And then number two, if anybody knows of an organization that does vocational programming, we're really looking for those programs that we can share with, those training programs that we can share with our youth. That way they can get engaged with those and then pursue that career pathway. So let me know if anybody has any questions, but if anybody has resources for either of those two, feel free to email me those. Thanks, Leanne. That was it.
Thank you so much, Christian. And last but not least, Debbie will give us an update for health and wellness.
Thank you, everyone. I'm going to actually to ask Tracy to share. I'm going to drop in the chat a survey that we're asking you to complete. So Tracy, you want to provide information around the survey?
Yes. We know that the pandemic has changed our lives drastically, but we still, are encouraging people to get out and get physically active and try to eat healthy. And so what we're doing is, and we've had our Move More Eat Healthy campaign going on, which Peter can share a little bit about our current challenge. But we wanted to just really find out how we are able to meet your needs. And so what we're asking is if all of you would take a few minutes to complete this survey. And then also if you wouldn't mind sharing it amongst your organizations, because really how we can try to increase people's physical activity and eating healthy, and then just their healthy lifestyle behaviors is by finding out what we can do to help support you. Because we also know that the vaccine is definitely important. There's no doubt about that. But we still need to continue to practice wearing a mask and safe distancing and sleeping well, but also taking care of yourself. Because if you have a strong immune system, that's going to help you that much more. So that means eating healthy, getting physical activity, keeping your mental health in good shape. So if you would just it's a very short survey. If you take a few minutes to complete this, you could probably even finish it by the time we're done with our meeting. And then please, like I said, share it with your organizations. And so now we can ask maybe Peter to give an update. Thank you.
Yes. So Debbie or Leanne, would I please be able to have permission to share my screen? Okay, thank you. So as all of you may have recalled from our last meeting, on behalf of Move More Eat Healthy, at the beginning of January, we launched our New Year, New Healthy You Challenge. And as Tracy mentioned, it's been such a huge of importance that we continue in movement and physical activity in order to have a strong immune system, not only obviously eating healthy and having a very healthy and nutrition-dense dietary intake. But at the beginning of January, we launched our New Year, New Healthy You Challenge in order to create some more excitement in regards to physical activity in the city of Fullerton. And so with this challenge, we are raffling off a $150 gift card to all of those who choose to participate. And it's completely open to any individual of any age group. And it does end February 28th at the end of this month. And so how do we enter? So how does the community enter into this challenge? And so the first step, it's very simple. There's 3 steps into being a participant of this challenge. The first step is to take our Healthy You pledge on our website at movemoreeathealthy.org. With that commitment or goal, ourselves and our interns do conduct follow-up calls just to assure that people are accomplishing their goals, or if they're maybe not accomplishing their goals, we do provide resources in order for them to accomplish their physical activity commitment. Step number 2 is through our Facebook and our different social media platforms with Move More Eat Healthy, we are sharing a lot of nutrition, health, mental health, and physical activity resources that the community can use in order to post step number 3, photos or videos of them completing or using these tips. And so with these photos and videos and content that's being shared on their different social media platforms, that's actually how they completely enter into this raffle. And so for every post that the community that any individual or participant actually posts on their different social media outlets, they actually get one raffle ticket into the grand raffle, which will be occurring sometime in March. And so when that social media post is being created, we do ask participants to tag Move More Eat Healthy and then hashtag New Year, New Healthy You, in order to enter the challenge. But as far as some statistics of how the challenge has gone, in the month of January, we did have 30 different virtual physical activity opportunities for the community to be able to create some sort of social media post. In total, we had for the month of January 384 participants actually engaging in one of our 30 opportunities. Of those 384, we did have 57 members of the community create some sort of social media post and create that goal commitment to the New Year, New Healthy You challenge. So again, I do want to remind everyone that we are offering Zumba classes, pound fitness classes, strength development classes, and also dance workout classes. So if you know of anyone who might be interested or you want to share Move More Eat Healthy resources, you can actually access our Facebook, Instagram, or website at Move More Eat Healthy, or our website at movemoreeathealthy.org in order for the city of Fullerton to access those resources. And finally, something that we are starting with the campaign, I know that we've had such a huge focus on physical activity, but we are starting up cooking classes for adults and youth. People who register, all they have to do is email me at phernandez@kpoc.org, and they'll get a personalized Zoom link just so they can access the class. And finally, something else that we've done is we've added pre-recorded physical activity videos for youth onto our website. Again, that's movemoreeathealthy.org. And for Facebook, quick statistical update, we have 1,159 followers for Facebook, and for Instagram, 1,066. So if you're interested in kind of seeing a little bit about what it is that we're doing, you can follow us or like us at Move More Eat Healthy. Thank you.
Thanks, Peter. What great information. And also, I know there was some information shared on our Facebook page for virtual PE. And as a reminder, all the Move More Eat Healthy classes are free, so there's no cost to that. And our next Move More Eat Healthy subcommittee meeting is virtual on Wednesday, the 24th of February at 10 a.m. I will drop in my contact information for you to get that link and that Zoom link, and that is open to everyone to come and join us. We have some great updates in the city and the work that they're doing along with the school districts. Both the high school and the elementary school districts participate along with the county level, and some great resources to actually be able to implement with your clients and your individuals that you work with and serve in the city of Fullerton. Once again, that date is on Wednesday, the 24th at 10 a.m. All right.
We do have a question for Jason from Harry. Are there any plans for having our collaborative homeless task force meetings again?
No, but there's plans to talk about it.
Yeah, we just talked about this
yeah, Harry, I'll reach out to you because I was just thinking about doing that. I saw the email you sent earlier about a thing on Saturday, so I'll contact you.
Yeah, and anybody else that's interested in those discussions. We had just spoke about this on our board meeting on Tuesday of what the city was doing and now they're not doing in ways that the collaborative can step back in, and what's most beneficial for all those partners involved. We always want to make sure we're not duplicating services and being effective with our time, because as you know, all of us are so pressed for time with all the work that we do. So definitely want to start those conversations again. Okay, I think if there's some announcements anybody wants to make that's not in the chat or that you've put in the chat and want to draw people's attention to, we have about 5 minutes and we can open up the floor for partner announcements.
Leanne, I want to also just give a shout out. We have actually 2 new members. I believe they're both on that just joined this past month. And so just a shout out to the YMCA. Thank you for joining us. And also Episcopal, sorry, I'm going to get the name correct. The Unitarian Universalist Congregation in Fullerton is as a member. And if you have, if you're interested in joining this organization and become a member of the collaborative, please reach out to me. We welcome also Emmanuel Episcopal Church in the city of Fullerton. Thank you for joining us.
So if there's no more announcements, I think that's it for this month's meeting. It was a great meeting with so much information. Thank you so much to Barry and Antonio for joining us and presenting today. We really appreciate it.
Eddie raised his hand. He has some.
Oh, okay.
Hey everyone, it's really nice to see all of you. I just wanted to give a quick invitation to everybody here that would like to join us to our upcoming COVID memorial on February 20th at 10 a.m. We're going to be hosting, like I said, a memorial, and if you have any remembrances or anybody that you would like honored, we'd be very, very happy to have them on our program. You know, it's very sensitive, and we're really aware of that, and we're really hoping that we can honor these people. So I'll be putting my email in the chat, and I would love to hear from you. And as always, have a good afternoon and take care.
Thank you so much, Eddie. Anybody else? I think that's it, Debbie, unless there's something on Facebook.
I'm not seeing anything on Facebook. We'll hang out for a few more minutes if people want to network some more, but we are so grateful that you joined us today. Our next meeting is planned for March the 8th at same 2:30 on the second Monday of each month. So thank you, everyone.
Thank you so much, everybody, for all the work you're doing. We appreciate you so much.